Welcome to the expanded consultation on technical assistance and health supply chains. UNICEF and partners have been developing a framework that can drive collective alignment towards country-owned, sustainable and continuous technical assistance for the health and immunization supply chain workforce. Supply chains are critical to ensure that every person has access to essential medicines, diagnostics, vaccines and technologies till the last mile. Health supply chains depend on the quality of its workforce. Capacity development and technical assistance should be considered a key investment in supply chain and health system strengthening. Even when the entry point is the immunization supply chain, there is a need to move from internationally dependent technical assistance towards a country-driven, institutionalized capacity development system. Human resources at sub-national levels need to be prioritized. You are the experts in supply chain and immunization service delivery. You know what works locally, and how things can be improved through better collaboration with partners. This consultation has 3 parts: a 3-week facilitated discussion on the IAPHL community of practice, a dedicated space at the TechNet21 website for additional materials and interviews on the topic, and a final webinar on October 15 coordinated by UNICEF where the proposed technical assistance framework containing your recommendations will be presented and discussed. To kick off our discussion, we would like to hear from you how technical assistance is being delivered. Our first question for discussion is related to how technical assistance is delivered currently. In your context, how is technical assistance meeting the capacity development needs of the supply chain workforce? In other words, what is working? We would also like to hear your suggestions on how, in your opinion, technical assistance could be delivered better, especially at sub-national levels. Please take into consideration that, ultimately, the success of sustainable technical assistance should have impact on supply chain maturity, and increased programmatic coverage. You may wish to consider certain aspects that influence building capacity. For instance, does every health worker have the same opportunities for learning? Does gender have an influence? Access to technology, human resources policies, and how about cultural factors and personal motivation? We invite you to think on developing supply chain competencies, but also on broader elements that affect the way that technical assistance is designed, planned, and delivered. Please join us at IAPHL's community of practice. We look forward to exchanging ideas and having a vibrant discussion on how to advance the planning and delivery of technical assistance.